So how do we fortify our psyche to ride the waves of adversity rather than being pulled under by the torrent? How is it that some people handle incredible amounts of stress while others quickly fall apart? The answer to these questions will show us that adapting to the demands and challenges in our lives involves a complex interaction between the person, the environment, and behaviour. Here's a preview of the biological, psychological, and environmental and social factors that influence our health and well-being. In this lecture, I want to look at some of the following questions. How important are the behavioural processes in health and well-being? How do psychologists intervene in order to promote health and well-being? In particular, I want to look at obesity and physical activity. What is stress and how does it influence our physical and emotional well-being? Why are some people able to withstand and even flourish under stressful life circumstances, whereas others fall prey to even minor stressors? What's the psychological profile of a highly resilient person? As medical advances have reduced the biological and economic causes of death and disease, there's been an increase in the impact of lifestyle choices the impact that lifestyle choices have on our health and well-being. There are a number of health compromising behaviours such as poor diet, physical inactivity, smoking, and harmful alcohol use, and a number of maladaptive stress coping strategies that are now major contributors to healthcare costs. There's a trend towards many of these health compromising behaviours increasing in society. In fact, the World Health Organization in 2009 identified the magnitude of the problem by identifying the major risk factors for deaths worldwide. High blood pressure is responsible for 13% of deaths. Tobacco use, responsible for 9% of deaths. High blood sugar, responsible for 6% of deaths. 6% of deaths also responsible for physical inactivity. Overweight and obesity, responsible for 5% of deaths. High cholesterol use, responsible for 5% of deaths. Unsafe sex practices, responsible for 4% of deaths. Alcohol use, responsible for 4% of deaths. Now, as you read through those, a number of those factors also increase the risk of major chronic diseases. For example, if you have a look at the behavioural risk factors for the 5 leading causes of death in Australia, you may notice that some of those health compromising behaviours, such as smoking, obesity, improper diet and a lack of exercise. Many of the leading causes of death in Australia are preventable. So you can see there's a substantial need for health improvement that's based on psychological theory, research and practice. When I talk about health-related behaviour, I'm really talking about 2 things. Health-enhancing behaviours that include exercise, the right eating, and safe sexual practices, for example. And health-threatening behaviours such as smoking, poor diets, and alcohol and drug use, and a sedentary lifestyle. These are the things that make illness more likely. Behavioural health promotion efforts usually try to increase the number of health-enhancing behaviours while reducing the number of health-threatening ones. And as we shall see, psychologists have developed programs that focus on both classes of behaviour. Today, what I want to focus on is obesity and sedentary lifestyle, and some of the approaches that a psychologist may take in each of these areas.